Good morning, everyone. My name is Ákos Mátrai, and I would like to hold my presentation about my 9 months progress report of my PhD work. I work as a specialist at the Department of Obstetrics and Gynecology, and my vision is to provide optimal pregnancy care that contributes to the birth of healthy fetuses. And my mission with my PhD work is to highlight the risk of infectious disease during pregnancy. First of all, let's see an overview about my 2 ongoing projects. The first is a systematic review and a meta-analysis, and the second is a registry analysis. Let's begin with my first topic. The title of the meta-analysis is Influenza in the first trimester increases the risk of birth defect. It's systematic review and the meta-analysis. Now we are at the article writing period. We finished the methods, the results, and the introduction part, and now we are finalizing the discussion part. The planned submission of this project is in June in a clinical infectious disease journal. Some words about the background. Flu is a very common infection. There are 50 million illnesses worldwide. And according to the Central Statistical Office, we have 400,000 cases per year in Hungary. We know that the birth prevalence of congenital malformation can be estimated at 3 to 5%, and these disorders underlie around 25% of perinatal mortality. Our aim with this study is to assess the effects of maternal influenza infection during pregnancy on birth defects. Our clinical question is, does the influenza during pregnancy increase the number of congenital malformations? We investigated the presence and the absence of influenza during pregnancy, and the outcome of the study are non-chromosomal birth defects. Our hypothesis is influenza occurring in the first trimester increases the risk of congenital abnormalities. As the first step, we made the the systematic search in 3 databases, and after we made the selection process, as you can see on the slide. Our first outcome are the oral clefts. Oral clefts are common birth defect with a worldwide incidence 1.7 per 1,000 live births. Babies with these birth defects have feeding difficulties, conducting hearing loss, and speech problems. As you can see, we investigated 4 studies. The heterogeneity was quite low, and the first trimester, we got the result that the first trimester maternal influenza infection was associated with an increased odds for developing cleft lip and palate. As the second outcome is neural tube defects. Neural tube defects are the birth defects of the brain, the spine, and the spinal cord. They happen in the first months of pregnancy, even often before the woman even knows that she is pregnant. We investigated these 4 studies. The heterogeneity was 0, and we got the result that the odds of having neural tube defect is 2.4 times higher in the influenza infected group than in the control group. The third outcome of the study are congenital heart defects. Congenital heart defects are one of the most important cause of perinatal mortality. We investigated 3 studies. The heterogeneity was 0 in this analysis too, and we got the result that the first trimester maternal influenza was also associated with an increased odds for development this kind of birth defect. Let's move on to the strengths and the limitations. The strengths of the study is the rigorous methodology. This is the first meta-analysis providing a comprehensive overview about maternal influenza infection in the first trimester and this association with all non-chromosomal birth defects. The articles came from all around the world. Among the limitations, we have to mention that the influenza definition was based on symptoms, and the most cases were self-reported influenza infections. Our conclusion is that the influenza in the first trimester increases the risk of non-chromosomal birth defects. Implication for practice is good to mention if flu is presented in the critical period, so in the first trimester, in the first 12 weeks, great emphasis should be placed on prenatal screening, and we should make effort to prevent flu during this time. We should vaccinate our pregnant women. Implication for research is develop and maintain a detailed, comprehensive database about the congenital abnormalities and pregnancy. Let's move on to the second project, which is the investigation of the effects of maternal influenza during pregnancy on birth defects in Hungarian population between 1980 and 2009. It's a registry analysis. As I told you before, flu is a very common disease, and non-chromosomal birth defects are the leading cause of perinatal mortality. Our aim with this study is to assess the effects of maternal influenza during the first trimester in Hungarian population in this time. Our clinical question, our PO, and our hypothesis is the same as I mentioned at the first project. I would like to say some words about our database. This database is the Hungarian case control surveillance of congenital abnormalities. It is unique in the world. It was established in 1980, and it contains data about 90,000 pregnancies. As the first step, we verified that influenza is a risk factor for the development of congenital abnormalities. After that, we examined what kind of disease can occur if flu is presented in the first trimester. These are the frequent congenital abnormalities if flu is presented in this time. We divided them in three big groups. These are congenital heart disease, neural tube defects, and oral clefts. We got the results that the odds of developing neural tube defects if flu is presented in the first trimester is 2.2. If we see the oral clefts, women who had flu in the first trimester has 2.2 times higher chance to have a baby with this kind of birth defects. And if we see the cardiovascular malformations, so the congenital heart defects, we got also an increased odds for this kind of birth defect. Now we are with this topic also at the article writing phases. We did the methods part, and after the meta-analysis, we would like to submit this project in July. Let's sum up the two ongoing projects, the meta-analysis and this cohort analysis. And I would like to close my presentation with a quote from Steve Jobs. Sometimes when you innovate, you make mistakes. It's the best to admit them quickly and get on with improving your other innovation. Thank you for your attention.
Thank you for your presentation. I was wondering, is there an optimal time for the vaccination of pregnant women against influenza? Because if we think about COVID, I know it's a different vaccination technology, but for example, there we said that women shouldn't be vaccinated in the first 12 months of the 12 weeks of the pregnancy, and also after vaccination, we didn't advise them to get pregnant for the next 2 months. So how do you see this question?
The vaccinations are really safe. It's a well-known topic. So in the first 12 weeks, we don't like to give medications or vaccination to the pregnant woman, but these vaccinations are safe. So before the pregnancy, there is no limitation, and after the 12 weeks, these vaccinations are really, really safe.
Okay, so in the first trimester, you don't advise them to get vaccinated necessarily, because you mentioned that even women who had influenza in the first trimester, they had.
Yes, it's the same like COVID vaccination.
Okay, thank you.
Thank you. Great presentation. Thank you for your time and effort. Just one question. How do you have this vaccination program included in the screening process or monitoring the pregnancy for all pregnant women in Hungary? And how many Hungarian pregnant women decide to get vaccinated? That's the first question. And the second one, when you compared these two groups that had influenza and that didn't have, how did you know that they did have influenza? What was the test? What was the process of identifying those women? Thank you.
At the meta-analysis or in our second project? Yeah. In our second project, there were three ways to get the information about the influenza. The nurses asked the woman after the pregnancy or during the pregnancy. There were a maternity logbook, so it's important, and and based on questionnaires too. Yeah, the best is if we do a PCR test, but in this database there were no PCR tests performed. They performed just questionnaires, and the influenza definition was based on the symptoms.
If I may add as Ákos' supervisor, so we accepted influenza diagnosis only if the patient had the typical signs and symptoms, and it happened in those weeks when the Hungarian Central Statistical Office declared an influenza pandemic in Hungary. So just those weeks with the typical signs. Yeah, and with the question. Yes. Yeah.
Do women in Hungary have this screening process or vaccination offered for insurance, including insurance, and
it's included in insurance. Yes?
Yeah, the influenza vaccination is included in the insurance, and the general practitioner offer the vaccination to the pregnant woman.
If someone, then pregnant women should be vaccinated. So, and they are offered the vaccination every pregnant. Most of them, yes. Most of them, yes, except that.
We have two types of vaccination in Hungary, and I think the better get the pregnant woman.